Coming up on Kentucky Outlook, a closer look at autism. For the more than 1 million people affected by some form of autism, greater awareness is the key to more research and treatment. Coming up on the program, dispelling some of the myths surrounding autism and how one regional facility is working from autism awareness to autism acceptance. And later in the show, should Kentucky students be taught more about evolution and climate change? We're going to talk about science core requirements. We're talking about education matters and autism next on Kentucky Outlook. Hello and welcome to this week's edition of Kentucky Outlook. I'm Barbara Deeb. We're glad you joined us. Well, we have a question for you. We got some reports today from the governor of the state of Kentucky boasting about a surge in high school graduations. Well, can we tout what the students are being taught as they graduate? We're going to talk more about that later in the program. But first, let's talk a little bit about autism and some of the myths surrounding autism. Welcome to the program, if you will, Marty Boman, who is the director of the Kelly Autism Program here at Western Kentucky University. Thanks for being here, Marty.
Thank you for having us.
In addition, we're going to meet for the first time the assistant director of the CAP, or the Kelly Autism Program at WKU, and her name is Christina Roantree. Noel, thank you for being here.
Thank you.
Before we go any further, and I don't want to spend the bulk of the time dispelling these myths because we could go on for hours, but just to give our audience just a basic understanding of what we're talking about when we say autism. From some of the research I did, they used to think that up until about 1984 that it was the parents' faulty parenting that caused autism. So help us get a working understanding of what we're talking about.
Autism is a neurological disorder, and I always tell the students and the participants' parents that the brain is just wired a little bit different. And just like I have things I can't do, so is it with our students. And so big part of that is not to think of themselves differently, but that different parts of their brain is working and activated.
Okay, in a different way. We hear a lot about something called the spectrum, the autism spectrum. What does that mean?
So there are currently 5 subsets on the autism spectrum, which include autism, pervasive developmental disorder, Asperger's, childhood disintegrative disorder, and really what we're talking about is a spectrum of symptoms that can include behavioral disorders, difficulties with communication, and difficulties with social skills, and restricted and repetitive interests.
So let's talk a little bit more about that, because this is intriguing. Now, we're hearing a lot more about autism over the last decade or so, I would say. Is that because we're becoming more aware?
I believe that the special education numbers are remaining the same, but I think we're doing a better identification component, and that is the critical part, helping these individuals so that they can reach their fullest potential.
And that's certainly what the Kelly Autism Program is doing. We're going to talk more about that as we proceed. But if a parent is out there, a grandparent, a caregiver, and they're dealing with a young child, what are some of the signs or symptoms that make, and I don't want to call them symptoms, but signs that may make them want to look further and say, maybe there's something bigger, deeper here, because early intervention is the key?
Yes. What we usually see is lack of communication skills, be that the visual eye contact or even the interaction of play that can be decreased. We also see things such as the need to not want to be touched or held, that these individuals want because of the sensory needs. There's a distancing that they do.
Well, what comes to mind is a colleague who recently visited the beach with her young children, and it's not unusual for a small child not to like the way that sand feels. It feels weird, it feels gritty. So where would you go to that next level where you're saying this is a little more than a child not liking sand?
This is, for our individuals, it's the way that the light shines on them, how that really interferes. We even see children who get actually sick because of certain odors. So it goes beyond the simple sensory issues you and I have. And we'd see it all the time with our participants.
And repetitive motion you talked about as well, where they can keep doing something and explain that.
So often in young kids, some of the first things that you'll see is lining up toys instead of playing with toys. So instead of kind of playing with reciprocal play, they'll line up cars. They'll also may engage in stereotypical behaviors, body rocking or hand flapping. And it's important that not every child with autism will engage in all of those behaviors. Some may line up cars, some may have difficulties with lights, some may do body rocking. It's, which is why it's kind of on the spectrum of disorders.
That almost sounds like an obsessive sort of behavior to line them up and continue, but it distinguishes. So gut is huge. As a mom, we all know that there's something that just doesn't feel right. How many times have you heard that when you have clients come to the Kelly Autism Program where a parent says, early on, I had a sense that something just didn't feel right?
We hear that a lot, particularly when they've taken their son or daughter to the doctor and the doctor tells them to wait a little bit longer to go ahead and do a diagnostic screening because of that. And we also hear on the other end that we have people that recognize right away certain symptoms that we need to address right away.
Well, when you say need to address right away, as with so many things, early intervention is critical. So because the spectrum runs the gamut, if you will, there are so many variations and so many levels and degrees. So early intervention across the board is critical.
Very important.
Okay, so what are we talking about? As early as age 2 or even before that?
Usually that identification comes around age 2 for our individuals who exhibit some of these. For instance, our individuals with Asperger's who are higher functioning and then can communicate generally, has the full range of the verbal communication. Those individuals get diagnosed later in life.
And we're going to talk more about the diagnosis and the Kelly Autism Program. So before we go to the break, tell us a little bit about the Kelly Autism Program. We talked about it being a regional facility, but really it's a national model in many ways.
We work with individuals from the ages 7 through adulthood. And with that, we work on the whole child, be it the communication piece, be it the social interaction. So social skills is very important. We work on the behaviors, the sensory, anything that they need assistance with. And it's really important because a lot of these individuals can work very well with adults or younger children, but it's their peer group that they struggle with. And you'll see many of these individuals that don't consider themselves to have friends.
And we're going to talk more about that and the importance of that peer integration when we continue our discussion about autism and the Kelly Autism Program at WKU when Kentucky Outlook continues. Stay with us. Kentucky Outlook continues. I'm your host, Barbara Deeb, and on the program today, we're talking about autism. There was a time when some believed that autism was related to parenting, poor parenting. It wasn't until around the mid-'80s that scientists identified a neurological link. We're talking about that on the show today, and later in the program, core science requirements and what that's going to mean for our Kentucky students. But right now, we return to Marty Boman and Christina Roantree Noel, who are with the Kelly Autism Program. Before the break, you gave us just a very brief description of what we're talking about when we say autism. We hear often that there is a spectrum, the spectrum of autism. What are we talking about, Christina?
With autism, we're really looking at, it's a neurological impairment that results in difficulties with social skills, communication, sometimes cognitive impairments, but really the degree to which a participant might have impairments in those areas varies. And so that's what, when we talk about a spectrum, it's this variance in communication, social skills, and cognitive abilities.
Temple Grandin comes to mind. She's very well known in this area, and I had the opportunity to interview her twice, and her story is just fascinating if you want to know more about autism. But a lot of hers was sensory. She didn't like to be touched and those kinds of things. Through the Kelly Autism Program, you're dealing with 7-year-old and on up to adulthood. One of the most poignant stories I ever heard was the story of 2 teenagers who were diagnosed with autism, and they had different degrees in the spectrum, but they were talking about their first kiss and how difficult that was because of this sensory issue to touch someone else's. You know, they really cared for this person. So we're talking about sensory integration as well.
Yes, and we have stories like that too that happen at the center, but it's interesting that to see that, because it's more than something that is just a sensitivity. For some of them, and in Temple Grandin's words, it's downright painful for some of her sensory issues. And we hear that from our students too. You know, when they digest some food and actually get sick to their stomach. And other times, you know, we have students that can put their hand on the hot stove and not feel the pain. It's interesting to see, and that's why it's trying to figure out all the puzzle pieces to put them together for these individuals.
And that isn't that the logo for the puzzle pieces, just putting those puzzle pieces together. Through the Kelly Autism Program, you were talking about the significance of, you know, when they're with adults, they can handle these issues, but then now integrating these individuals into a setting where they're with peers. That's huge.
That's huge for them. They want to have friends. It's interesting to see, but the big thing is that things that you and I take for granted, for instance, how do you say hello to someone? How do you ask a girl out on a date? That's something we've got to practice with them and practice over and over, because they can do it in one setting, but then they can't generalize it to another or struggle to generalize it.
So through the Kelly Autism Program, I know there are a number of initiatives underway. You certainly don't just address the individual with autism, you're looking at the whole family.
Yes.
And how to work together in that regard.
Most definitely, because the strategies need to be practiced in a number of settings.
And especially in the home setting.
Yes.
Especially in the home setting. Now, speaking of the home setting and family and familial domestic support, you actually had a parent, is this correct, who ran marathons and raised money for the center?
We are very fortunate. One of our college fathers decided to help support us so that we could have an endowment fund. And with that, he ran 4 marathons this spring and summer, and he did it. His goal was to raise $25,000, and he's up beyond that. So we're really excited. And right now with the WKU campaign, we're hoping to have that doubled. So.
Excellent. So one of the other opportunities that has come your way recently through the autism program is Can Do. And Can Do is a service dog. Tell a little bit about that.
Can Do will be coming. He's being trained right now, very highly trained with gal Heather from FEMA. She is working with right now.
Federal Emergency Management Agency?
Yes.
Okay.
And will be working with us. He'll spend half of the day with the veterans, and then the other half of the day with us down at the clinical education complex. And a big part that we're seeing is that anxiety or that anxiousness that our students go through, and to help them relax and get focused.
In the presence of the animal. And it's a golden retriever?
It is an English golden retriever.
English golden retriever.
Yes.
So it has an accent, as it were. But so it's going to be there, and you'll share it with the veterans.
Yes.
And that's. But if someone's watching this and they're learning a little bit more through this, certainly there's a whole lot to learn about autism. One of your logos, one of your themes is you want to go from autism awareness to autism acceptance,
Yes.
which says that not all individuals with autism are accepted.
Yes.
So we as a people need to do a better job of that?
Well, I think where we're really seeing the impact is as we prepare these individuals for college or for a job. Who is going to hire them? Who is going to pay an equitable wage for them? Right now, there's such a discrepancy between that wage, regardless what kind of job they get, regardless if they have their college degree or not, and that we have to get that up to the equity level, and that's a big issue.
And just graduating these individuals, getting them graduated from college. Is that and it's a very real goal, you're seeing it happen before your eyes. Talk a little bit about that.
I'll address that because right now we are seeing in our college program, we have 47 students, and we have a number of seniors, and a number of super seniors who are taking another year, but we're going to see a big group graduating, and we're very excited about that because a number of them are planning to go on for their masters and maybe even their PhDs.
So through the Kelly Autism Program, do you have to be referred there through a physician, or how does that work?
They can come and apply. And with that said, they receive 12 hours of study tables every week. And with that, we work on their executive functioning skills, their social interactions and everything. They get a double room for the price of a double room, which we make into a single, but they pay the cheaper price. And they also get a mentor, and then they have a lot of socials. For instance, we're going to Gatlinburg with the college students over fall break, so we're excited about that.
I bet. So now that's for the college kids, but
Yeah.
you start as young as 7 years old.
Yes.
So anybody in that, you might be watching this program and say, I could certainly use the services available through the Kelly Autism Program. They just have to call?
Yeah, if they call, we have an after-school program from 3 to 4:30 on Monday through Thursday, and then Friday it's 3 to 6. And so I know on Friday we have a lot of our participants come from further away, so we do it for a 3-hour segment. And during that time we group them for social skills, communication. We work on movement and sensory and all of that. And so if you just contact the Kelly Autism Program, we'll set it up and do an intake. So.
Excellent. So to the people watching this program who have learned a little bit more about autism, Marty, what words of wisdom would you leave them with? Certainly you want to get to that place of acceptance, but in the interim?
In the interim, be their friend. That's an important part. A lot of these individuals are by themselves, and that becomes an issue. We just had one of our little gals give a presentation, and she was talking about how she was never invited out to do anything on Friday night, how lonely her life was. And yes, she has mom at home, but she wants to be social. She wants to be out with her friends. So ask them to do things with you and be their friends. They're wonderful people.
We're all people, exactly. We've been talking with Marty Boman, the director of the Kelly Autism Program, and we've been joined for these past couple of segments with Christina Noel, who's the assistant director at the Kelly Autism Program. And we've been talking about going from acceptance and awareness, well, from awareness to acceptance. We'll get there. And don't go away, because when Kentucky Outlook continues, we're going to talk more about the science core requirements. Should our Kentucky students be allowed to study evolution and climate change? We're going to talk about that when Kentucky Outlook continues. Stay with us. Kentucky Outlook continues. I'm Barbara Deeb. Don't forget, you can find us at wkyupbs.org. And right now, our program is continuing as we take a look at education. We're always curious as to what's going on in the education field, and who better to address that than, of course, the Dean of the College of Education and Behavioral Sciences at WKU, Dr. Sam Evans. Thank you for joining us.
Thank you.
We called you here today specifically because we want to talk about, well, as we record this program, Governor Beshear was talking about how great our numbers are when it comes to high school graduations right now. And he credits that in large part to Kentucky leaders being reform-minded. In essence, saying that we had to reform what was happening. We were always at the bottom. We want to get back up there. Well, one of the larger issues earlier this week related to the governor had to do with science, when we talk about core curriculum and science. And there was a committee that decided that they didn't think they wanted to teach our students about evolution and climate change. Governor Beshear says, yeah, we need to teach them that, and he was going to sign it anyway. Let's talk a little bit more about these, what we call STEM, which is science, technology, engineering, and math, these equivalents, and how important they are to training our future workforces.
The STEM areas are very important in terms of what we're doing, preparing people for careers, many of which may not be identified as of today. And we're wanting to make sure that all of our students are what we call college and career ready. And the figures came out yesterday. 86% of our students are considered to be college and career ready, and that is it's 86% of our students are graduating from high school. 50+% of our students are considered to be college and career ready. The next generation science standards are one part of that equation. So it is extremely important that we do focus on those things in our public schools that will make sure, to the fullest extent possible, our children and youth are prepared for the world of work or to go on into post-secondary education.
Okay, so 86% are graduating, 55%?
50+%.
50
They
plus.
said over 50%.
Okay, so that's 30 plus, that's somewhere there in the middle and probably not ready, okay? So we have to get them ready. You pointed out something a little bit earlier, and you said preparing them for jobs that may not even exist.
Right.
How does one ready a workforce for jobs that we don't even know what's going to be out there? And we're talking a lot about the science areas and engineering, aren't we?
Science areas will be a big part of that. I think the key is when you're thinking about careers that at this point in time we don't know what they're going to be, we've got to make sure that our students in school are prepared when we think about critical thinking, problem solving, decision making, to be able to address those issues and problems that at this point in time we're not aware of, or the skills that are connected with critical thinking that they're going to be able to use in, as of this point, undefined careers. And when I look at the science standards, I look at the Common Core state standards, there is a focus on critical thinking, problem solving, decision making, being able to be literate from a mathematical perspective, being able to write, being able to read. All of those things will help our graduates be prepared for careers that exist today and those that we yet are to be determined.
To be determined. So what I'm hearing you say is you give them the basics. You give them that foundation where they can be a critical thinker, where they can be a problem solver. And so regardless of what those jobs of the future are going to be, they're going to have the skills that it's going to take to make that happen.
Absolutely correct. And when we think of, I'm going to say, some of the controversy that's swirling around the next generation science standards, content has not been removed from the standards per se. When you're thinking about helping students develop skills to be successful, content is used to help develop those skills. When you're thinking about issues, those issues may involve science, they may involve other disciplines, but there is a content base that students will be using as they're developing those skills.
So you're talking about, when you're saying content in particular, you're talking about the climate change issue?
It could be aspects of science, could be mathematics, could be engineering, technology, but it could be what are the concepts that could be related to climate change. As we're helping students develop skills, they're going to be using that content to help them not only solve current issues, future issues, but it also helps inform them in terms of what they are currently doing so that they themselves can make good decisions. I think part of what we have to prepare our students to do is to look at the information that's readily available, analyze the information and data that are available, and they themselves have to make decisions that are considered to be good decisions in the context of which that learning is occurring.
You know, do you think, and I know you've been doing some research on this as well, that the reason that these core science standards maybe put off the red alarm, evolution has always been controversial, always. And the minute you say that word, regardless of how it's going to be used in this content, it puts up the red flag.
I think you're correct there. And I think one thing as educators and those of us who work in the field of education, we have to be mindful of is the fact that we're not always going to dictate what young children, adolescents, young adults believe, but we can help them become better informed in terms of their own belief systems and the information that they can pull together related to what they believe. It's not being critical of one particular belief system or not, or one particular theory, but it's being informed in terms, I might believe a certain thing. I need to be informed as to why I believe what I believe.
Especially, and as we heard in the earlier segment when we were talking about autism awareness and preparing individuals with the autism to be ready for the workforce, we have to prepare all people to be ready for this changing global place that we call the workplace.
That's, I think, on target in terms of where we are today. When you think of the knowledge that we possess at the current time related to what we possess at the time many of us went through the school systems, it's increased tremendously. So some of the knowledge that we gained through rote memory, that may not be necessary today, but we are going to need to have the tools to access that information so that it can be used when we're thinking about talking or discussing about the issues that are surfacing in our current culture and society.
So where does it stand with these core requirements? You know, is there a deadline? We have to come to some consensus before X day, or how does that work?
The information that I have read in reference to deadlines per se, the governor has his own time frame in which he may choose to sign the letter related to his decision that we're moving forward. Once he signs that particular letter, then we will be moving forward. It is my understanding that this can also come back to the General Assembly to be addressed. And so down the road, I don't know that we can predict, but I would say we have an obligation to the children in our schools today to move forward. And the Commissioner of Education, I think, is very much on target. The growth of our students is important, the success of our students is important, and as a Commonwealth, we have the responsibility to do those things, to make sure they are as prepared as they can possibly be.
So those are some good words of wisdom to leave us with. And in preparing those students for the future, in your opinion, are we doing a good enough job?
We are doing a good job. We can always do better. I have seen tremendous growth in student learning in the Commonwealth of Kentucky. As you indicated earlier in our conversation, one time we were close to the bottom. Kentucky is very well respected today. We are looked at as the leaders in education reform. So we need to keep moving forward in the work that we're doing so that our students can keep advancing in terms of their performance in our schools.
We've been talking about the core curriculum requirements, in particular the science core curriculum requirements in the state of education in the Commonwealth, with the Dean of the College of Education and Behavioral Sciences at WKU, Dr. Sam Evans. Thank you for joining us.
Thank you very much.
And that's going to wrap it up for this week's edition of Kentucky Outlook. Don't forget to follow us on Facebook and, of course, visit our website at wkyupbs.org. Until next time, I'm Barbara Deeb. We're glad you're here.